Hello everyone, welcome to my YouTube channel Dr. Akif Baig. Today we will be talking about sinus arrhythmia. Minor variations in the PP intervals is present in most subjects. So normally what happens is that normally the PP interval, P means atrial depolarization and QRS, and this is a T wave. So this is the one heartbeat actually. So normally some variation in the heartbeat duration may occur because of the respiratory variation, which is normally it occurs. So normally usually it does not exceed 0.16 seconds. So that is the PP interval. So P interval from here, distance of this P from this P, this distance is normally the variation of that is not more than 0.16 seconds or 160 milliseconds. So if you compare, so this P to this P and this P to this P, if you calculate the duration, this duration should not be, variation should not be more than 0.16 seconds. So suppose this duration is more than 0.16 seconds, then it is called as sinus arrhythmia. So there are four variants of sinus arrhythmia. The first variant is the phasic sinus arrhythmia, which is the most common one, which occurs due to respiration, changes in respiration. So what happens with inspiration? There is increase in heart rate. So the P wave, the duration also decreases. The PP duration also decreases. With increase in heart rate, the P wave amplitude increase. As the heart rate decreases, the P wave amplitude decreases. So slowly, when the respiration is kept in control, this rhythm disappears. So this is a more common type, which occurs variation in heart rate is related to the respiratory cycle. The sinus rate increases gradually during inspiration and decreases with expiration. The variation is attributed to change in vagal tone. The arrhythmia is a normal phenomena that is usually prevalent in infants and children and tends to decreases with age. Coming to non-phasic sinus arrhythmia, non-phasic sinus arrhythmia is one which is not related, which has no relationship with the breathing pattern, the respiration. So it's called as non-phasic sinus arrhythmia. So the P wave and PR interval are normal. The P wave and PR interval is also normal, but randomly there occurs some arrhythmia. Randomly there occurs some sinus arrhythmia here. So there is no relationship with the breathing, but randomly there will be what happens. The duration of the PP interval varies randomly. The cause is not known. So the non-respiratory sinus arrhythmia is more likely to be seen in elderly patients usually in association with heart disease usually. In many instances, the mechanism is unknown, but in some cases, the sinus arrhythmia is a manifestation of sinus node dysfunction. It is also seen in patients with raised intracranial pressure. Ventriculophasic sinus arrhythmia, it is another variant of sinus arrhythmia in which it is commonly seen in patients with partial or complete atrioventricular block. So in this, what happens is in patients with atrioventricular block, the PP interval containing the QRS complex is shorter. So there is a AV dissociation. So atria beats independently and ventricle beats independently. The PP interval which contains the QRS complex is shorter than the PP interval not containing the QRS complex. For example, see, this is a P wave. This is again a small P wave which just came here. So this P and QRS has no relationship with each other. That's why it is called as AV dissociation or complete heart block. But the P and P duration, where it contains the QRS wave, is shorter when compared to P and P wave, where there is no QRS. So there is no QRS between this P and this P, but this duration is found to be longer and this duration is shorter, as you can see here. So this is called as ventriculophasic sinus arrhythmia. It is seen in 30 to 40% of patients with complete AV block and less often with second degree AV block. Next is wandering atrial pacemaker. Wandering atrial pacemaker is an atrial rhythm where the pacemaking activity of the heart originates from the different locations within the atria. So as the name itself suggests, the pacemaker is wandering. Normally, the normal pacemaker is the sinoatrial node. So suppose other than sinoatrial node, if any other pacemaker is acting in the any other ectopic foci, if it acts as a pacemaker in the atrium, then it is called as wandering atrial pacemaker. So now what will happen is one time there will be sinus node which is acting as a pacemaker. So it will give a one morphology of a P wave. Sometimes other later on one other ectopic foci is the pacemaker. So there will be other type of P wave. The morphology of P wave changes. So it is diagnosed by there must be at least 3 different P wave morphologies in a single ECG to diagnose it as wandering atrial pacemaker. So this is very much similar to multifocal atrial tachycardia, where also more than 3 morphology of P waves is seen in a single ECG. If you see more than 3 patterns, 3 different morphology of ECG. So how do you differentiate multifocal atrial tachycardia with wandering atrial pacemaker is by the rate. If the heart rate is more than 100 beats per minute, then it is called as multifocal atrial tachycardia. If the heart rate is less than 100 beats per minute, then it is called as wandering atrial pacemaker. Hope you have liked this video. If you want more videos like this, do subscribe to my YouTube channel, Dr. Akif Baig. If you have any comments, do test it in my comment box. We'll get to you soon. Thank you.